You're now locked onto the Pulse Radio Show with Marcus Myers, X-Tina, and Ken Pyle. And on the 1 and 2s, Big Red the DJ. It's the Pulse Radio Show, baby. Believe that.
You know, Marcus, after every entertaining show, we always come with some common sense. We always come with something educational to enlighten the people.
Yeah, it's
different topics,
yeah.
and this week is like no other.
Yeah, very, very insightful. And you know, we've spoken about, you know, the human body with the doctor before and medicine and stuff, but there's a part of the body that we need a bit more focus on, right? And you know, and that is, you know, your teeth. Because
your mouth.
That's the first thing. Your mouth in general, because that's the first thing that people see. Like whether it's smiling, whether it's, you know, talking, they're gonna smell you, they're gonna see you. So,
without no further ado, I would like to welcome to the Pulse Radio Show, Dr. Ramon Harvey, DDS. DDS, man.
Good night. Thanks for having me. Pleasure to be here.
Wait, you got some nice pearly whites here, though.
I had a good dentist.
But you know that not all dentists have teeth like that, though. I remember a dentist that I had that I was like, you know that you need yourself, though.
Yeah, man. A lot of the time, the people in the know, you know, don't take care of themselves. Yeah. Y'all try to encourage that. I mean, you know, amongst our staff, we try to encourage taking care of yourself.
And that's where I want to start. And this is going to sound like a dumb question, but I've had conversations like this before with friends. Why do you need to go to the dentist regularly?
Main reason is because, again, there's not a lot of knowledge about what really affects your mouth or how that affects your general health. Most people don't look at their teeth. Most people don't, you know, take a mirror every now and then and check all their teeth and gums and make sure that everything is okay.
You just brush them and then go.
Yeah.
In most cases.
Not even flossing. Floss will save you so much time and money. Just
flossing, yeah.
Just floss. It's so important. But yeah, and most cavities or other things in the mouth may not present until they get to a point where they're serious to deal with. So, you know, the average Bayesian, I can say that, but a lot of Bayesians don't go to the dentist until something's hurting.
Yeah.
By that time, it's pretty far gone and there's usually some other issues going on.
Yeah, that's a good point, because the argument that I was having was if somebody said, well, if I brush my teeth like twice a day, 3 times a day, like I'm supposed to, then what's the need for going and spending that money on a dentist?
Yeah, and aside from, again, general oral hygiene and cavities and periodontal disease, gum disease, things like that, there are other factors that contribute to general buildup of things. Your diet, how you eat, what you eat, exactly how well you're brushing your teeth. A lot of people think they're brushing their teeth well and they're really not. And they might be missing some areas. Again, not everybody's flossing.
You missed a spot.
Yeah, all of those things. And then aside from that, you know, even the best of us, even dentists, brushing and flossing, you get buildup along the teeth and along the gum line. That just happens as a part of biology. We all have bacteria in our mouths. Bacteria, it exists, and we have to keep those levels to a low. Otherwise, the food that we eat, they're going to act on that and going to produce disease and things you don't want. Bad breath, all these kind of things.
So how often do you recommend people like see a dentist?
At least twice a year. At least every 6 months. You should be getting a cleaning and visiting your dentist, getting a full examination, oral examination. And then on a basis need after that, if you need to go more regularly, then, you know, you follow your dentist or your hygienist instructions as well.
Yeah. Seeing that most of your patients, well, if not all of your patients are Bayesians, what are some of the trends that you see Bayesians do, whether it's eating or taking care of their teeth, etc.?
You see a lot of negative trends that we're seeing lately in general. There's a lot of gum disease happening, which is why, again, I want to stress flossing, visiting the dentist, because gum disease...
Can gum disease be caused by something other than what you put inside your mouth?
Yeah, they can have a lot of contributing factors, some of which nicotine smoke, cigarette smoking, or tobacco use in general. You see more in the States where people chew tobacco, but down here as well, that contributes to gum disease, diabetes, or uncontrolled. Anything that is suppressing your immune system, lupus, anything else like that, HIV, going unchecked, that can affect your general health and healing, and that affects your mouth a lot as well too.
Is it visible, like gum disease? Like, can I talk to somebody and look at them and be like, "Wait, you got gum disease, though?" You know?
Yeah, usually, you may find that people are, so they say long.
I'm trying not to laugh. But anyway, go ahead.
It can be, and again, a lot of people, you know, you see Los Febreze ads where people get nose blind. A lot of people may be nose blind, but there is usually an aroma that accommodates.
An aroma?
Wow.
A pungency.
There can be a pungency, but, you know, things like symptoms to look for, like swelling, or pain in the gums and in the jaw, loose, mobile, shaky teeth. When the gums and the bone that supports those teeth becomes attacked. It recedes a little bit, and then the teeth aren't being supported as much, so they become mobile. You may find if you have a loose teeth, or you're bleeding when you brush or when you floss, that's a sign of gingivitis leading on to periodontitis and gum disease, which again, very hard to reverse, very hard to maintain.
Right.
And it can affect your overall health because the bacteria that like to infect our gums also like to infect our hearts. Asians who have a high incidence of high blood pressure, heart disease. If you have gum disease and diabetes,
and that's how we tie it back in, though. Yeah.
So that's so you would say
your risk of stroke or anything is significantly higher.
So you would say like Bajans especially that are more prone to those kind of non-communicable diseases should definitely be going to the dentist often.
Definitely, because when you think about it, almost everything you put in your body goes through your mouth. The air you breathe, what you drink, what you eat. All of that passes through your mouth. So if your mouth isn't healthy in that first portal of entry, if you're bringing more disease and introducing that into your system, then it's going to affect you in general.
You ever had to do a procedure and the body breath smell real stink? And you was like, "Mama, I'm going to get some Listerine now. Watch you all come back."
Come out things.
You see a bit of everything.
Right.
You see a bit of everything. I'll leave it at that.
It was never overbranded. You was like, "Boss, take that little cup of Listerine."
No, not. It's obviously, you have to be professional and my view on it too is you have to kind of have an objective view on things because I'm seeing what we have to fix.
Yeah.
So I'm not looking at, this is bad. I'm saying, well, we can improve this. It's not so bad. Or if it is that bad, let me educate you on how it got so bad and what we can do in order to fix it, reverse some of these things, and get your oral health back to where it needs to be.
What's one of the worst cases you ever saw?
You like your horror stories?
Yeah, I like your horror stories.
I've seen a lot of it.
Let's give me one, man.
One thing that I do see a lot and I never like to see.
Maggots.
No, I've never seen that.
Marcus, anyone?
Talk, man.
But yeah, a lot of infection, again, gum infection or infection from a tooth that can, have someone's face or jaw swollen. And it really...
And by infection, you mean inflammation, pus?
Yeah, that kind of thing. Where you may have a cavity that goes to the nerve becomes infected, or your gums and your bone become infected. And that can have your face swollen, it can swell your jaw, affect your lymph nodes.
Oh, wow. Yeah.
Bad taste in your mouth. And it's not pleasant for the patient as well, because it's not a good time. Then you have to have antibiotics and all of this, and then seek treatment.
Control the infection.
Again, if things are at that point, there's a lot going on.
Yeah.
So regular visits to the dentist, regular oral hygiene, watching your diet, and things like that will help to prevent all these things. Prevention and maintenance is always better than trying to fix things.
Yeah, so I want to talk about the people on Instagram that like longing out them tongue, right? But little do they know that their tongue needs work.
Yeah, you gotta brush your tongue too.
What's the best way to brush it? Because it's sometimes for me, it's just be like, sometimes I don't want to do that, even in a picture or whatever, even though I wouldn't. That's just weird. But if I did long on my tongue, I would feel like I miss a spot though. So I just don't do that. What's the best way to brush your tongue? Is it like a certain way to do it so that all of it?
There are these scrapers, and then there's a brush.
Exactly.
Which one do you recommend more?
Scrapers usually do a better job because of how the tongue is structured, and the tongue tends to harbor a lot more particles on it. And a brush, because you shouldn't be using a hard, not even really a medium toothbrush. A soft toothbrush is ideal.
Okay.
I ain't gonna I admit it's on national radio. When I brush my teeth with a soft toothbrush, I don't feel like I brush my teeth. I won't feel like I scrub and brush in my mouth.
Yeah.
The negative consequences of that are you can actually brush away your gums. A lot of people use a lot of pressure when they brush as well too. So you have a hard, a scrubbing brush, Brillo pad type thing. And you're brushing with a lot of pressure. One, you can brush away your gums and you get a lot of gingival recession there. And two, you also scratch your teeth up.
Right.
And going back to aesthetics and health, people are seeking nice, bright, shiny white teeth. If you're scratching away your enamel, you're removing that layer that's polished, and then you're actually thinning the enamel as well too.
And you don't get that
enamel
back.
gets, then the more of that dentin that's underneath, that yellow starts to show through.
Yeah.
Oh.
So using a hard toothbrush and abrasive toothpaste and things like that can actually do more damage than good.
Out to go buy a soft toothbrush.
In terms of the aesthetic side, I'm seeing a lot of people go in the direction of the tooth enlargement. Is that something that's popular here?
Well, when you say tooth enlargement, you mean
getting into the narrow type,
Yeah, popular everywhere, I would say. It's something that, your smile, like Marcus was saying, is one of those things that people see first. Right. And that, depending on a lot of people, whether you're in sales industry, radio, anything you do, TV, you want to have that presentation, that smile. You want to appear to, have a general, like you're taking care of yourself and have a nice appearance and a professional appearance. And a lot of that goes to confidence as well, too. A lot of people don't smile or don't carry themselves with confidence because they may not have a nice smile. They may have teeth that they're worried about, or they may be missing teeth.
Right.
They may have a gummy smile. So there are a lot of aesthetic things.
Gummy smile.
Yeah. A lot of aesthetic things you can do in order to enhance that smile, and that can literally change people's lives.
Wow. Yeah. So not only is it a physical thing, but there's a psychological aspect as well too.
Yeah, it is. It
is. Like nobody can see my pictures before I had braces.
I had braces too.
If I look back at photos before I had braces, I literally it's like a shock. It's like I don't even want to see it.
Then you have nice teeth.
Thank you.
There you go.
I know nice teeth too.
Yes. You do have nice teeth. You know that I have braces and my teeth still look bad?
You probably did not.
My teeth look weird. I
probably didn't take care of them.
When was the last time you went to your dentist?
You're
maybe
very malicious, actually. No, I went to the dentist, that was September. That's long.
You went recently. I remember you talking about it.
Yeah, I got my teeth cleaned though, but I did not get an examination.
You should have an examination.
So do you think that you should get you said twice a year? Mm-hmm. That's for the examination.
Or the cleaning.
And the cleaning and the examination.
Cleaning and examination.
Yes.
Oh, okay.
Reason being, a lot of things, if you do have a problem, say you have a small cavity that's starting, or something that may become a cavity, usually in about 6 months you would see those significant changes in the mouth. So if there's something happening, we can check up in 6 months, and if it's becoming a problem, we can try to solve it before it really starts.
Ma got me here licking my teeth all
over. You're looking at feet.
No, I had a cavity once. I never want one again. So I think I'm gonna start getting into that routine of the examination and stuff. I still have permanent retainers, so I would go back to the orthodontist to get those checked, but I wouldn't get like an actual full examination and cleaning and all of that. So I will.
Yeah, it's just like the rest of your body. You're going to get your regular checkups, get your blood pressure, your blood sugar, get your teeth checked, and make sure that you're healthy.
Can you explain something to me? I had a cavity too, right? And I actually needed to get a root canal. But the thing is the pain that I was feeling was on one side, but I had to get the root canal on the other side. Can you explain that to me? I heard it was called something like ghost pain or something.
You can get referred pain. Rarely it will actually jump from one side to another. But I have seen it happen. But usually it happens with the upper and the lower. But a lot of the nerves, you can get referred pain.
Right.
The nerves in the mouth and in the face are very sensitive as well, too. Yeah.
So that's why I wasn't seeing it, because I was feeling pain in one area. And I was like, well, I'm not seeing anything. What could this thing be? And she was like, well, you know that it's actually tooth cross there, though. You ain't look cross there. And it was actually, she was right.
Yeah, I've seen a couple of cases like that. It can be an interesting puzzle to solve.
That's weird. So anybody listening, you really got to get your teeth checked. Definitely. So I can't really get into always brush your teeth because people got like see an actual visual or something. But I don't think people brush their teeth properly. That's the thing. I don't think a lot of people do know how to. And we actually see it.
And regular visits will also assist with that. Because I'm sure you guys will let persons know how to do it.
Go home after tipsy and all the KFC and brush your teeth before you went to sleep?
I think I fell asleep.
Yeah. Listen, the couch right there, the door right there.
You can imagine if you draw asleep and then you wake up the next morning and then you didn't brush your teeth.
We can just do the...
And it happens.
We could do like, if you just want to do a quick thing, we could just like wash up with Listerine and that's it.
You should try and brush your teeth.
Yeah.
That's a response.
Yes.
So why do people
encourage you?
Nothing, but just take the extra time and clean your teeth.
So why do people use Listerine? Is Listerine a replacement for brushing your teeth, or is it like a supplementary? Right.
Supplementary. Any mouthwash should be supplementary because again, toothbrush only gets certain areas, and you only get in between the teeth, which is why flossing is so important too. But you have food particles and bacteria that exist on our tongue, our gums, our cheeks.
Yeah.
What's the primary ingredient of mouthwash?
A lot of different. It varies.
So there's no real alternative. Let's say that you were somewhere and you wanted to get a quick little rinse.
Yeah.
And don't drink the seawater needed.
Oh, it's salt water. Seawater isn't sterile. If you can just get some warm salt water, and that's better than nothing.
Yeah.
Nothing at all again. But there are a lot of different mouthwashes for different reasons that have different ingredients, and once you're using something, something is better than nothing.
In terms of whitening your teeth, I see people use charcoal Is it blackened charcoal?
It's activated charcoal.
Activated charcoal, and very cheap, right?
I know as well too.
Yeah, and are there any side effects to using that for whitening your teeth?
Not to my knowledge as yet, no.
So what do you recommend? What do you recommend?
Makes it sink a little messy, but
yeah.
What about the regular peroxide?
It seems to be doing well. Regular peroxide for whitening the teeth.
For whitening, yeah.
I wouldn't encourage that. Use regular peroxide can be pretty caustic to the tissues in the mouth as well too.
Yeah.
Some people do rinse with it. I encourage them to mix it at least 50-50 with some water.
Dilute it, okay.
Yeah, and don't swallow it. Rinse and gargle, and only if you really have tonsillitis or something else.
Do not swallow. Don't swallow it,
Do not drink peroxide.
I think I will just stay away from that.
Not drink peroxide. But for bleaching the teeth and whitening, there are specific kinds of peroxide that are designed to safely whiten enamel. Because if you get wrong concentrations, you're using the wrong chemicals in your mouth. Again, it's your mouth.
Yeah.
There are a lot of vital structures nearby, and all that ingestion into your body. You don't want to be trying something that can be harmful. You don't want to be brushing your teeth with Vicks or anything like that.
Vicks?
Pussy.
Vim.
Take a bite. Vim.
There you go. Vim.
So what about swallowing Listerine? Asking for myself.
I think that's alcoholic behavior. You should.
Let you burn, Susie.
So this is something that you do.
By mistake, or was it deliberate?
How much mouthwash you drink before tipsy?
There's alcohol-free Listerine as well too for those who don't like the burn. Still use some mouthwash. Get a good gargle, rinse everything out.
I'll admit I walk with Listerine everywhere that I go. So sometimes I'm in the car. If I'm leaving the car, but
do you walk with your floss as well too?
No.
Someone actually told me that those individual flossers, the toothpick flossers, are not good for you. Would you recommend those or?
Case by case basis for me. I have patients who prefer using those or get a better result using them because of how their teeth may be arranged or because of their dexterity. Again, a lot of people, if you have a little bit of arthritis or if you're not very good with your hands, manipulating the floss and getting between all the teeth can be a bit difficult. And those can make it a lot easier for some patients as well. Some patients it don't work well for it. So again, to me, a lot of things are relative, case by case. A lot of things work. You can choose a repertoire that works for you. Visit your dentist regularly. Make sure you're getting your checkups and make sure that you're following oral hygiene at home. Those 6 months in between us seeing you, you have to do your job and make sure you're taking care of your health as well too. Right. And if there are any issues, then we can take care of that.
Speaking of teeth arrangement, I had a friend at school. We used to call him Rock Biter. There was no question. I just wanted to say.
You said bite rocks.
Nah, it looked so. So that was
Marcus, I feel you used to call him.
That's what we used to call him.
If I could touch on something that reminds me of, a lot of people try to open bottles with their teeth.
And I see that, and I think that's
see a lot of broken teeth.
You can break your tooth.
Chip to breaking to needing to get it extracted, and then if it extracted the tooth, you should replace it as well too. You got all those teeth for a reason, and when you take a tooth out, a lot of negative consequences happen in your mouth as well.
How susceptible is the mouth to contracting STDs? Like very.
Yeah.
So you can't put your mouth everywhere.
No.
You can't.
You really shouldn't. You really can if you want, but you shouldn't. I wouldn't recommend it.
So maybe say any and everywhere. What do you mean? So if we find a lady in the club, is that any?
I saw a video.
Any everywhere.
I saw a video on Instagram this morning of a lady licking a garbage dumpster as a dare. She got $300 for it, but
$300 only.
Yeah, I did. Yeah,
you had to give me $10 million and still no, because then I would probably spend that $10 million.
And there was actually a trail of saliva to prove that she licked this. A skip.
What were you watching?
Yeah, what were you like?
That's the bigger question.
Is there a way that you can tell, like, if you look at someone's mouth, if they have an STD from their hygiene?
Certain STDs present around the mouth. A lot of the times, dentists are the ones who first would diagnose that.
Really?
Yeah, because a lot of them have oral lesions.
Right.
Most people will know just by popular culture media. If you have oral herpes, you get a lesion every now and then.
Right.
So, you may see that flare up during a dental visit. Some other STDs have dental presentations as well too, or their systemic effect on the body will show up in the mouth.
Like what?
First, I remember when I was studying in school in DC, we had a lot of HIV patients that we were treating in the clinic, and when they were severely presenting, you would see their immune system gets hit. So things like the nail beds and your lips and your gums also show effects of that.
Okay.
So when you see those presentations and you see the response of a poor immune system wreaking havoc on the mouth, then it will lead you to investigate other more systemic things.
Okay. And fine. Well, my last question would be: are there any side effects to using dental dams?
For
what?
We use dental dams and dentistry for.
You're talking about that, eh?
The other dental dams.
Yeah. Is there any side effects to using that?
Not that I know.
All right, this is completely off my head. I have no idea what y'all are talking about.
Oh, you don't know what dental dam is?
No, but
but
we're fine.
But no. Well,
I'm not. I don't know if I can or should fully speak on it, but.
No.
It would seem like it's being safer than not using it.
Right. Well, the thing is, a dental dam is for when you want to do oral sex, right? When you said just now that your mouth is very susceptible to STDs.
HPV is on the rise.
Exactly. Yes. So, I didn't know that actually.
Yes, it is.
Oh wow. But the dental dam is I guess protection for your mouth and stuff. So I wanted to know if there are any side effects to people using them.
It's like a mouth condom.
Yeah,
somewhat.
Basically.
Not to my knowledge. I don't know all the literature or all the literature on dental dam and dental dam usage.
Oh, okay. Well,
if you have a latex allergy, don't use a latex one. I would say.
That's
plastic.
But
that's a little outside of my particular scope of topic.
Well, I think we should think about that. I want to do some more research on that, seeing that you said your mouth is so susceptible. You shouldn't put any and everywhere.
You should.
So for the any and everywhere fellas.
I put any everything in it either. Can't put any everything in it.
It's true.
Like bad foods and stuff. And other stuff.
Just put floss in it and healthy things.
And with that said, Dr. Harvey, thank you for coming. This is the first time we're talking about dental hygiene and oral hygiene. I really appreciate you coming, and we will take some of what you said into account. All of it, really.
Glad to be here. Yeah. Thanks for having me.
Thank you.
Big up!
With that said.